Welcome back to my channel. My name is Panashe Mudengerere. Today I just wanted to take you through my most memorable case during my clinical years, which has only been a year so far, but this is my most memorable case. On one day during my internal medicine rotation, as we were rounding, my registrar got a call and he answered the call, talked to the person, and when he was done he told us that he needed to go down to the surgical department to review a case. We asked him what the case was and he told us it was a rabies case. So we asked if we could come with him because we're like, whoa, rabies. Most seniors have never seen a rabies case in their lifetime, and this was a great opportunity for us to learn a lot. So he accepted and we went down with him. On our way there, he was explaining to us all about the symptoms, the transmission, and everything about rabies. I will explain that in a bit. Getting there, my first sight was a man mid-30s who was laying in bed. He was obviously salivating in his mouth and he kept his hand like this the whole time. And around him was his family. You could tell there was love. His son would be there by his side. And they'll play this game where the son tries to bite the dad and the dad tries to bite back, and then the son says, no, don't bite me. With time, as you observed, you'd see that there'll be some episodes of mania where the man gets aggressive and tries to throw things away. But of course he was mainly active from his shoulders going upwards, not much of the lower extremities and the upper extremities. The story behind this was really sad. What happened was he was at home one day. A dog came in through the gate that was left open and bit him, and it went off. Then they went to the clinic, and at the clinic he was given a tetanus shot, not a rabies shot. He stayed for quite some time, about 4 months, until the symptoms started to appear, but it was then too late. Here's what happens with rabies. When an animal that's infected with the virus bites you, the virus in the saliva is transmitted to the peripheral nerves through the skin, eventually leading to the central nervous system. It has an incubation period of about 4 to 12 weeks, which is roughly about 1 to 3 months. And during this time, the disease is preventable. You can use post-exposure prophylaxis and wound care. The post-exposure prophylaxis contains rabies immunoglobulins and rabies vaccine. Without these preventative measures, the patient starts to show symptoms. It starts off with flu-like symptoms and then progresses to acute rabies encephalitis. The typical symptoms that are shown are fever, hydrophobia, hypersalivation, and stupor. This may alternate with mania, where the patient is actually trying to bite you. And in some patients, this may be accompanied with ascending paralysis similar to that of GBS. It's important to note that there's no cure for the disease, and once the symptoms start, it is almost fatal. For this patient, we had to tell the family that the chances of survival were very low, and it was very sad for me. It's one of my most memorable cases because it wasn't the patient's fault that the disease progressed like this. The health professionals should have made sure that they gave the patient the right prophylaxis. I didn't get to follow up on the case because I had exams coming up and we're not allowed into the hospital when exams are approaching because those are the same patients that we will examine. But I really do hope that the patient recovered, and if he didn't, my prayers go to his family. Thank you for watching. Remember to like, comment, share, and subscribe.